Hi everyone. So I'm here to do my newborn assessment. This is the area, my baby, the blanket. This is the area. There's no notes or anything there. So I'm trying to angle it so my head's in there. Just what I have it sitting on is pretty low. So just bear with me. All right. So to get started, I would knock on the door, ask if it's okay if I come in. Then I would introduce myself to mom and the family in there, and I would talk to the parents to make sure it's okay if I do a newborn assessment. I would also ask like the birth history, whether they were born via C-section or vaginal birth, and then ask if there was any complications as well. I should be noted for. I would also then getting the okay from mom. I would wash my hands and glove up to do the newborn assessment. I would just, before I start anything, I would look at the baby's overall appearance, make sure the body is aligned, and make sure the extremities are all there and that there's no cyanosis noted on the body or anything as well. I would also look at the skin to make sure that, to see if there's any vernix left. Vernix is the white, I don't want to say cheesy, white cheesy film on the skin. And while the baby's like before the baby's born, the vernix is there to protect the baby, protect the skin, and as it gets closer to full term, the vernix tends to shed. Now, depending on the gestational age of the baby when they were born, whether or not the vernix would still be there or not, but it's okay that it's there. It'll go away. It'll wash away. And then I would look for vernix. I would look for milia, which are like white. Small like white bumps, I believe, are usually around the nose, I believe, but that's normal as well. I believe it's from like calcium, I want to say. I also look for meibomian spots, which is like a birthmark. It's usually dark in color, like a bluish gray, I believe, color, depending on the skin tone of the baby. I would also look for petechiae, which is like a red rash noted on the baby, and it's like commonly like in, I want to say the crevices. I'm probably not sure, but I do know petechiae is like a red rash that would be on the skin. Then after noting everything, I would move to the baby's head, and while I'm here, I would check the I would check the head circumference and the chest circumference. The head circumference, I would use the eyebrows as a guide. I would do it above the eyes, and then I would check the chest by using the nipple line as a guide. And then the head is normally bigger than the chest. That's normal, and that's okay. I would also check the baby's temperature, pulse, heart rate, and respiratory rate. In the heart rate, I would use the apical pulse, and I would do it for 1 full minute, not 30 seconds. The full minute to get the most accurate. All right, so I did the scan. So we move along to the head, and I would check for anterior and posterior fontanelles, make sure that they're soft. I believe they're supposed to be like a triangle, if I can remember correctly. I would also check for what is the word? Cephalohematoma, which is like a pocket of fluid on the head, like I want to say it's full of blood, but I know it's a pocket of fluid. I'll have to double check that as well. On the head, I would note for that as well. I would check for molding. Oh, and caput as well, depending on the baby, if it's vaginally birth or C-section, but they should still have molding on there. And then I would check the face, make sure the face is symmetrical, like the eyes are symmetrical to the ears, make sure the eyes are symmetrical like between the nose, and there's no cyanosis around the mouth. I would check her eyes, make sure that her eyes, I would check the iris, the color of the irises, which are usually gray, I believe they're gray normally. I would check for strabismus, which is noted normal for newborns, and then I would check for the pupils. Now the pupils will be sluggish, that's normal as well, but they will be reactant to light and accommodate to that. And then I would check the ears to make sure there's no deformities and that they're well formed, and make sure they're in line with the eyes, I believe. I would also check the nose, make sure the nostrils are patent, and the baby's able to breathe okay. From there, I would check the mouth. I would put my gloved finger, which is my pinky, in the mouth, and I would check around the palate to check for holes or anything in there. I would check for it. Amps. What is it? Amstein pearls around the mouth as well. I would check. This is where I would check the sucking and the swallowing, reflexes as well while I am there. And then I would go down to the neck. I would inspect the neck to make sure everything looks good there. There's no nothing caught in the neck or anything. I would check the clavicles to make sure they're not broken, or if they were broken, I guess there's a process for that as well. Then I would move down to the chest. I would check baby's chest, make sure that the skin is how it's supposed to look, like depending on the tone of the baby's skin color. I would check to make sure there's no engorgement in the nipple area and the chest area. I would also listen to bowel sounds while I'm here. I would listen to bowel sounds because after the baby's born, the bowels are active and there should be activity going on down there. I would inspect the cord area, the cord spot, to make sure there's 2 arteries and 1 vein still there. And to make sure, I guess, yeah, it should still be there. I guess it depends. But I would check the cord, needless to say. I would still check the cord. And here I would ask the parents how the baby's been voiding, whether they've been void, like how many times so far. They noted the meconium. If it's a female, I would check like their genital area. But if it's a female, I would check to make sure the labia is covering the clitoris. And then if it were a male, this is a female. If it were a male, I would check the meatus location and the testes location. And I would note if there's rugae on the scrotum sac or the scrotum. So I would note that as well. I guess I'll put her diaper back on for this next part. The next part I'm checking, I'm checking the extremities to make sure they're symmetrical and that, you know, there's no rashes or anything as well, which I did at first. I checked the body at first, but this time we're checking for range of motion, and we're checking to make sure they don't have like a hip, what's it called? A hip dislocation. And we're checking for range of motion on the baby. Oh, I forgot. We're also going to ask the parents for the voiding patterns as well. I guess what you already said, actually. So this part, I believe this is where I would do some of the reflexes. So the first reflex we're going to do, can you see me okay? First reflex we're going to do is, we're going to do this one because this is easier for me. We're going to do the stepping reflex, which is you place the baby up on their feet to see if they're stepping or they're placing their feet down, which is normal. We're going to check the Moro reflex, which is like a star reflex. So we're going to lift the baby up a little bit by their hands like this and drop it, and they should be like startled, like their hands should go like that. While I'm here, I would check the palmar reflex, put my fingers here to make sure the baby is squeezing my fingers. I would also do the plantar reflex, which is right. I would put my finger right underneath the toes and do the same thing to make sure that they're gripping. I did the sucking and the swallowing reflex. Oh, the rooting reflex is when I had put my finger by the mouth here on the side of the mouth, and they should try to, I guess they would gravitate towards their kind of like a feeding, like if they're on the nipple. And I believe, I would do the Babinski next. The rooting I would have did earlier with the sucking and swallowing. I forgot to say, I'm sorry. But with Babinski, we would put our finger or an instrument at the bottom of the heel and move it and curve around the toes, and it should flex. And if not, then it's a sign of a CNS defect, which is the central nervous system defect. If it doesn't, I have to turn the baby around. I believe this is the Gallant reflex, is where we would put our fingers around on the side, like up and down on the side, and the baby should flex towards that area. And same for the other side, it should flex for that area as well. And I think that is all. At this point, I would give baby a new diaper. I would wrap her back up in her blanket, put her clothes back on, and hand her back to mom and or dad or the parent. And just to make sure, you know, check with mom, see if there's anything that they need or the baby might need before I head out. Yeah, so that's my newborn assessment. Just if I did anything wrong or forgot anything, please let me know.